space is all about. So last week we had a very intriguing discussion about the digital health platform. We discussed matters of interoperability. We discussed what needs to be done for things to be interoperable. And a key thing that came out was the National Health Dictionary. And today, that's the session we're going to discuss about.
Hello, can you hear me?
Apologies for that technical hitch. Dr. Amina just dropped off for a bit, but we're getting her back on. So we're back for your patience and we sort it out in a few minutes. Thank you.
Apologies for that. Jared, I hope you can give us a bit of a brief prior to Ian coming in.
Sorry, it's actually Ian who's in the meeting.
Oh, sorry, Ian. Welcome. So Ian, welcome to the platform today. Last week, we had a very good discussion on digital health platform on interoperability. And today, we can't wait to hear from you on National Health Data Dictionary. Welcome.
Thank you very much. Yes, so let me just set up a presentation. Can you see my screen?
Yes, we can.
Okay, yeah. So as I'm sure Jared had mentioned in the last meeting, at the core of health interoperability, you need a good terminology service to be able to share data, and for that data to have meaning across the different players within the health sector, which is why we decided to come up with the Kenya National Health Data Dictionary. So what the dictionary is, it's a consolidation of coding standards which describe identity, diseases, observations, healthcare procedures, investigations, and drugs, following clinical rules and guidelines. So what this is, it's just a single repository from which every player in the health sector has to reference to get information about what they're sharing. So what this enables, it enables meaning to be carried across different systems. So if you're sharing your health record from system A to system B, that health record will be understandable by the second system, and it will also be able to be used to make support decisions. So a good justification for this that I usually like to use is like diarrhea. There are many different ways to write diarrhea. Some people usually write it with an EA, others usually finish it with an OEA. So when you share diarrhea with an EA to a system that uses the diarrhea with an OEA, the meaning wouldn't be carried across. So to that second system, those will be two different things. So which is why we have the data dictionary. It provides a single source of truth. So instead of passing the disease, you'll have a code for that disease, similar to how you use the WHO coding for ICD. So you'll get a code for that particular diarrhea disease. Then that's what you will share to the other members. Am I audible enough?
Yes, yeah, you're audible. We can hear you clearly, and you can also see the screen well.
Okay, thank you. Yeah, so as I mentioned, the objectives of the Kenya National Health Data Dictionary is to provide a single source of truth. So that means every player in the sector basically has to reference KNH-DD and to use it when transmitting data across the sector. It also enables interoperability, which also ties into the first point. So once everybody is referencing the same place, there is no subjectiveness of the information you're sharing. If you share information about a particular disease, we are all sure that we are referencing the same disease. And because of that, it enables the health records to be interoperable across the whole ecosystem. And it also enables mapping to international definitions. So the terminology service that we've employed for the Kenya National Health Data Dictionary, it allows you to create mappings to different international definitions. So once we get onto the demo part, I'll be able to show how you can have a particular disease, and you can also see its equivalence code in ICD-10, its equivalence code in ICD-11, and even other definitions such as LOINC. And finally, it also streamlines reporting. So it enables you to report much easier because you're all referencing the same variables, and the set of choices that are available to you are all the same across the industry. So it enables easy reporting. Yeah, so the end goal of the National Health Data Dictionary is to have a validated, semantically rich, and controlled terminology registry, which is based on established standards such as ICD-11, the Service Master, the Drugs Registry. So all this comes together to make the electronic health record meaningful. As I'm sure Jared had mentioned in the previous meeting, the terminology service, it will be managed by the key players in the ecosystem. Like in the case for drugs, it will be managed by people like the Pharmacy and Poisons Board. So by having this authoritative figure behind it, you're just sure that you are referencing what is approved for use in the country. And yeah. So like, so how is the dictionary managed? We are using this open source tool called Open Concept Lab. So we took it after performing a SWOT analysis on different terminology services that were available at the time. We identified that Open Concept Lab was the strongest among all that we considered. And so we just customized it to be able to meet our needs, and deployed it within our own servers at the Ministry of Health Data Center. So the terminology service is fully owned and operated by us. And if there's anything that needs to be added onto the service, there are a set of operational procedures that can be followed to make sure that these new concepts are added onto the dictionary. So maybe I can hand it over to you, Dr. Amina. So if there's any question up to this point, I'm willing to take them before we get onto the demo.
Yeah, so basically we like doing our Q&A after the whole session, and we also prefer if anybody has a question, please address it in the Q&A panel. I think there was a demonstration you have to do now. We'll do the demonstrations and probably take questions from there. Thank you.
Okay. So let me just open up my browser and I'll start another screen share. Yeah, so actually the system is live, and let me just share a link onto the chat so that everyone can access it. Can everyone see my screen?
I went to the link, so I don't know about the other people, but I'm busy with the other link. But yeah, we can see your screen.
Okay, I hope the font is legible enough. If not, you can just request me to increase the size. Okay, so this is the National Health Data Dictionary. As you can see, it's hosted at nhdd.health.go.ke. So once you land there, you'll see that the page that you land at, it has different tabs, and I'll go over them, explaining them. I'll first start with the organizations. So as I mentioned earlier, the NHDD, it's a terminology service. So it's meant to be a single source of truth for every coded concept. So it also allows you to have different organizations within the system, and that is how you're able to create mappings between different dictionaries, if I may call them that. Yeah, between different dictionaries, but in here you can see they're available under sources. So I'll just do a short demonstration using the Ministry of Health organization. So once we started the National Health Data Dictionary, we decided to adopt SEAL as the source of the initial information that we were going to use to come up with NHDD codes. So we seeded this information from CL. So there's a one-to-one mapping between each concept in this NHDD source to concepts within CL and also concepts within WHO. So like if I may click on, let me just search for malaria. Oh, so sorry. Sorry about that. Turns out I was muted.
Yeah,
so,
it's okay.
I'll just begin with malaria. As you can see, we have malaria and it has the following code 43323. So this is the code that I was talking about. So this is the code that players in the health sector will be using when referencing malaria. So like if a person is being attended at a facility that is employing KNH-UoN, then they want to share their record to maybe another facility which is employing their own unique system. Instead of writing malaria as the observation that somebody was diagnosed with, they'll just be able to send 43323. And the other system on the other side, because they're also mandated to use the National Health Data Dictionary as their source of truth, they'll be able to understand that this code means malaria. So they'll be able to use it within their own internal system. So I'll just, I don't know why these mappings aren't showing, but I'll just try to open it manually. Then we can see. Yeah, so as you can see, because of the ability of this open concept lab, it allows us to create relationships between different dictionaries. Yeah. In this case, you can see from the MOH and HDD dictionary, we have this code 43323 that is being mapped to code 61462000 in Snowmed City. So basically, what this allows us, it's as you know, like it streamlines reporting. So like if you want to generate reports and maybe you're using ICD-11 standard for reporting, you're still able to easily convert the codes that you have within your own internal systems to external coding schemes such as ICD-11, such as SNOMED and the likes.
Okay.
Yeah, and also it enables you even to share data, even not only within Kenya, but also to share data across the world. So like maybe if somebody is being referred to a facility in India or even in the United States, you're still able to share their health record. But now in this case, you will share them using a coding standard that maybe is recognized within international or LOINC. Yeah, so it's such a powerful tool, which is why we decided to use it. And as you can see, I'll just go back to the organizations page. We've been able to add that feature, and within it, we've also been able to seed data for ICD-11 and ICD-10. So it has all these mappings, which it's actually the foundational basis for creating a health sector that is truly interoperable, because we need people to be able to communicate the same meaning. Yeah, so it's the foundation from which health interoperability is possible. Yeah. Yeah, so I'll just do a short demo where I'll show how this system allows you to capture different types of concepts. It's not only limited to diseases. I know within the NHDD dictionary, maybe we just saw a lot of diseases, but it can actually be used to capture everything from medications to health technologies to even diseases and even substances and procedures. So let me just open a new tab. Allow me to switch the windows again.
Sorry, Ian. I thought I was the only one, but somebody's saying you're not loud enough. I don't know if you can be a bit louder. We'll appreciate.
Okay, let me see what I can do.
Yeah. Ian, we're losing you completely.
I'll just sorry. I was tweaking my settings, but I don't know. Am I much
It's
much
a
more
bit
later?
better. Yeah.
It's a bit better. Okay.
Yeah, it's a bit better.
Let me just change a few things. Yeah, so let me open the other window, then I'll begin the demonstration on how these concepts are created.
Okay, we're here eagerly waiting.
Okay. I hope you can see my screen. Hello.
Yeah, yes, we can.
Okay, okay. Yeah, so so each organization within the National Health Data Dictionary, within this terminology service, is allowed to have multiple sources. So like in the case of WHO, you can see we have ICD-11 and we have ICD-10. Let me just go to a different, I'll use MOH for the sake of this demonstration. Yeah, so as you can see currently at MOH, we only have one source, which is called NHDD. But the system is flexible enough; it allows us to have multiple sources. So for the purposes of this demonstration, I'll just go ahead and add a new source, and I'll use it as okay. I'll create a source of medicine. So let's say it's the Pharmacy and Poisons Board that is creating an authoritative reference of all drugs that should be used within the country. So I'll just allow me to fill up this form. Yeah, so yeah, another thing that I should mention is that these terminologies, they won't just be managed by anyone. There's a whole governance structure around it, because somebody needs to be a terminologist to be able to know how to clearly come up with these concepts and how they relate to each other. Yeah, so there's ongoing work on the governance aspect of it. And I'm sure also some players in the sector have also been engaged in line with coming up with their own sources within the terminology service. Yeah, so I've already created this drug source, and now I'll go ahead and create a concept. So a concept is just it's like a thing that has meaning. So in the case of this drugs concept, you can call each drug can be its own concept. Each brand can be its own concept. Each formulation can be its own concept. And now you can start creating relationships between these different types of concepts, so that in the end you can have like malaria. Okay, let me just use something that I know, like a Panadol tablet with a strength of 500 grams. Yeah, so that's how you can relate these concepts together to be able to add more meaning to them. So I'll go ahead and create a concept. in this case, okay, I know like for drugs, you usually start with a generic, then you go on to the brands. So I'll just start with a generic. So for the concept ID, I'll just set it as one. Then for the concepts class, I'll use, let me see. Then for the data type, I'll just set it to none because this isn't a question you're asking somebody. Then I'll come and create the different names for this. Specific knowledge. Yeah, another beautiful things about this terminology service is that it allows you to create different. Okay, it allows you to create concepts, and within those concepts, you can add multiple different synonyms for the same concept. So this allows you to search for the concept by any of the names that it's known by. So like in this case, I'll just go ahead and add paracetamol, and I'll put acetaminophen as its synonym. Then once people search on the system, they can be able to search using any of these two names. And also you can even add, if there was a Swahili name for paracetamol, you can also add it here, and people will still be able to search using it. And now, as I was saying earlier, because what we are sharing is just one, we'll all be referencing the same thing, as much as maybe Dr. Amina may be saying paracetamol and I may be saying acetaminophen. Yeah, then you can also add descriptions to be able to bring out more meaning about the concepts that you are creating. So let me just copy paracetamol description from Wikipedia and use it there.
Sorry, I got lost a little bit. DuckDuckGo is another tab, or it's part of
What?
DuckDuckGo. Ama, it's your search.
No, I
was
just searching for the description of
Oh,
a
that's a search
paracetamol.
engine you use. Okay, fine.
Yeah,
Sorry.
yeah.
We are used to Google, some of us.
No problem. Yeah, so I'll go ahead and create this concept. Yeah, so as you can see, we have paracetamol. Yeah, then once we click on it, we can see all its names and synonyms. You can see the description that's outlined there. I'll go ahead and create one formulation. So concept ID 2, concept class, it's a drug formulation. Data type, I'll set it to none because, okay, for this data type, unless something it's a question, we don't usually set it. So like maybe if it's a question like date of birth and you're expecting a date time, that's when you'll come and set date time. But now in this case, I'm just describing a drug formulation. So it's not really a question, it's more of a statement. So that's why for data type, I'm selecting none. Then I'll go ahead and create the name of this formulation. So I'll just use the English over here. Fully specified. So in this case, I'll just create a tablet. Yeah. Go ahead and create it. Then now I can go ahead even and create, now I can create a Panadol now. We know a Panadol is a paracetamol, and we can also associate it to being a tablet. So I'll go ahead and add a concept. Concept ID 3. Concept class, it's a drug. Data type is still none because it's not a question. The name is English, really specified, Panadol. Yeah, actually, I can just use this. Yeah, so I'll go ahead and create this. Then now I'll go ahead and show you how we can create relationships between these three concepts, because we know a Panadol is still a paracetamol. So I'll go ahead and click on these two concepts. Then I'll create a mapping between them. So it's a mapping from Panadol to paracetamol. So we know that a Panadol is a paracetamol. So in this case, I'll come and set the map type to become, okay, actually, we can use using substance, because, okay, is paracetamol an ingredient of Panadol, or is Panadol a paracetamol? I don't know the exact relationship between them.
Sorry, Panadol is usually a brand name, and paracetamol is the generic name. So
the relationship that best captures that relationship is a Panadol is a paracetamol.
Yes, Panadol is a paracetamol, and you can have it in different names. Zipladol, different companies have different names.
Okay, no problem. Yeah, so the terminology service allows you to create all sorts of relationships between the concepts that you have. You can also have question and answer relationships. So that's useful, like in the case, maybe you're asking a person, where were you born? So you can create a relationship between the question, where are you born, and maybe a set of counties. So all of these are concepts within the system. So you'll have a concept that's a question, and other concepts that are answers, like now Nairobi County. So you can create a Q&A relationship between where are you born and Nairobi County. Yeah, so in this case, I'll just use Eva, and I'll go ahead and create it. Then we also know that this Panadol 500 mg oral tablet, it's also a tablet. So I'll go ahead and create another mapping. Okay, I'll just use Isa because I don't know the exact relationship. So I hope you can pardon me for that.
Yeah. So just to make things clear, this is like how you map out things to make them a bit more local, to show how configurable the system is on your end. And it's a process that keeps on going, as opposed to it's already cast in stone. So the National Health Data Dictionary is still in development, like every other dictionary, and it will have continuous updates, right?
Yeah, exactly. Actually, this sources within the National Health Data Dictionary, they're designed to be iterative in nature. So, like in the case of maybe the drugs source that will be published by the Pharmacy and Poisons Board, they can have a specific schedule within which they'll be updating the concepts within the platform to make sure everything is up to date. Maybe if there are drugs that have been retired from use within the country, they can go ahead and retire those concepts. Yeah, so
Yeah.
as I mentioned, it's a continuous process, and yeah, the work within the NHDD really never stops, because it has to fit to the guidelines and procedures that are present in the nation.
So there's a question. I'm sorry, I'm just going to ask you questions to just bring more clarity. So what's so different about the Kenya National Health Data Dictionary to the ICD-11? Because currently we're using ICD-11 from 10. And I've seen at some point you showed the relationship, how they're linked together. So I'm sure that's the background, but why are we advocating for the National Health Data Dictionary?
Yeah, so it's more about localization, and also yeah, it's actually more about localization. There may be some things within the ICD-11 that aren't that aren't okay. There may be some things within Kenya that aren't accurately captured within ICD-11. So we need to have that flexibility to be able to use our own terms,
Yeah.
even though maybe in other international standards. So you can think of this as a superset of ICD-11. So in that the things that we have are our own, and we can extend them independent of ICD-11. But if needs come, if need comes, we can still map back to ICD-11. And
Because
the other thing, yeah, the other thing is that ICD-11 actually isn't usually an interface terminology. It's more useful for reporting purposes. Now we have interface terminologies like CL, which are designed to be much more friendly to clinicians. Yeah, in that the way the things are described, it's how a clinician will think. So that's why
Yeah.
we are coming up with this NHDD.
In fact, one of the biggest challenges we face sometimes is inaccurate coding. So the research quality for the local data becomes really subsidized. And one of the conversations I've had with several health information officers is we need to have our own coding terminologies to make it easier. But at the same time, I love how it's still our own, but it's still connected to the national data because the interface is ours. It's communicating. It's something easy for us to know. I love how all of you in MOH, you love malaria. I've had so many examples of malaria. I think Costarians to Western are the pioneers to this. Probably, I don't know, but I really kudos to the team for that. But I'm seeing Colombia International eHealth Lab. So do other countries do this? Is this an innovation in Kenya, or are there other countries that have done such their own health data dictionary that taps into the wider ICD-11? Yeah, might you know?
Okay, what I know for sure is that we are first in Africa because we
Okay.
really want to kickstart the health interoperability platform within the nation. So before we do that, we first have to make sure that every one of us who's communicating, we all mean the same thing. So yeah, we are the pioneers in Africa. That I can say for sure.
Ah, nice. So you can continue. Sorry, I rudely interrupted you, but you
Any
can
other
continue.
question?
Did you finish? I think you are here. You can continue, then we can move on. I didn't want to take you back.
Sorry, I haven't quite got it since I have some network issues.
Yeah, so while your internet is loading, someone's asking, Emily is asking, what's the difference between Kenya National Health Data Dictionary and the drug dictionary used in pharmaceutical, British Pharmacopoeia, US Pharmacopoeia, or even Kenya Drug Index?
Yeah, so the Kenya National Health Data Dictionary, even the Kenyan Drug Index will be seeded into this platform. So basically, what we are saying is that it's just a single source of truth where everyone can have easy access to that information. So even the Kenyan Drug Index in the future it will be managed and updated from this terminology service. Yeah, so yeah, I don't know if I've quite answered that question.
No, you have. So we are also taking the already formed local data dictionaries like Kenya Index. You have addressed the question. However, feel free, Emily, to ask if it was not properly addressed. Is your network back? So while we're keeping waiting on that, someone is asking how will compatibility with this standard be enforced across vendors operating in the EMR space? Yeah, tough question.
Okay, I'll answer that. So we've already had some engagement with Kenya EMR, AMPATH, and yeah, Kenya EMR. So the team behind it, it's Palladium. We've also had some engagement with AMPATH and also EDAP. So we are trying to bring together every person in the health sector. We are trying to bring them to the same table, so that once we start rolling this thing out, we are sure that we are all referencing from the same book. And also the other thing is that I know there's a bill in place that mandates the Ministry of Health to make sure that all the health information systems within the country are comprehensive, and they all there's health interoperability between the same sector. So yeah, we've engaged the sectors we've engaged the players in the sector, and also there's a legal framework around it to make sure that we are all on the same page. Can you hear me?
Yeah, we can. I'll wait for your screen to change for me to know the network issues are back. You can stop sharing while you're sorting it out. Someone is asking, does this site contain patient information, and is it running on smart contracts for sharing through all hospitals? Yeah, I'm sorry, I'm making you multitask. Ian, you're muted. Apologies, don't know. Probably Ian is having a bit of network challenges. Hi, Jared, how are you?
Sorry, it's actually Ian. I lost.
Oh, you're together. Okay.
There's a question
side, but I can't hear you very well.
Okay, I see there's a question about yeah, I seem to be having a lot of occasions today. Uh, hello, can you hear me?
Barely, but I think you're back now well compared to previously. I could barely hear you.
Hello, can you hear me?
Yeah, I can hear you now.
Sorry, I'm having such a horrible experience with my network connection right now.
It's okay. It happens.
Yeah, so I can see a question within the chat that's asking about the security of information on the National Health Data Repository. The information that the information that will be stored within the National Health Data Dictionary, there's no personally identifying information. It's just information about things like procedures, diseases, drugs, substances, and stuff like that. So the National Health Data Dictionary won't be used to store any personal information. It's just used to store information that helps support the diagnosis process. Yeah.
So basically, there would be no personal information about the patient, and it's in compliance with the Data Protection Act. Another question is, what progress has Kenya made in adopting EMR in public health facilities? I believe, Ian.
Yeah, so I know in the sector there are quite a few of EMRs that are being used, and also in the coming weeks, DHPs will also be adopted. Yeah, so we are making good progress in terms of transitioning to a digital health record.
Thank you. And to have a strong digital health platform, it's very important to have a health dictionary, which is the interface is quite good. So another question from Emily is, will all the health workers be trained to adopt the new system? If so, what are the modalities of achieving the same?
Okay, so the National Health Data Dictionary, as I mentioned before, there's a governance aspect around it. So the people who will be directly creating concepts and updating it, there'll be terminologists, so they'll also undergo some training where they will be showed how to use the system. Then for the rest of the health sector, they'll just be consuming from it. So you don't really need some specialized training. Yeah, you can just be shown a demo of how to reference the system. Then yeah, you can be able to use it from that point.
Okay. And I guess I hope you'll understand this, but have you considered all health promotion and disease prevention indicators? That was a question from someone. Teresa.
Yes, yeah, with Minara. This is Jared.
Yes, Jared.
Maybe just to respond to the question. The idea of the platform really is to create the common language that all of us can speak. And it's from the creating the common language, then you can be able now to start talking about data linkages. Because if you don't have a common language that you're using to communicate, then we cannot be able to integrate. We cannot be able to share data in a manner that can be consumed and be interpreted in the same manner. So that is the overall objective really of having this national data dictionary defined, so that then all of us are aligned to that. Then from there now we can start talking about integration and interoperability. And so to answer the question is that the platform is there to allow all the terminologies that we are using as a country to be defined and given specific codes, so that then when we reference those specific codes and share this data, it may from one user, from the sender to the recipient. The communication is the same. The meaning of that communication is shared across between the sender and the recipient. So that is really the main goal, the overall goal of all this that we are doing as far as the national data dictionary is concerned. Just creating a common language, and the platform is dynamic enough to be able to capture all the terminologies that we feel like need to be defined within the sector. So any terminology is missing, then we have Minara's talked about the terminologists who are going to be managing these terminologies and concepts. So they go, it will go through the process of approval and ensuring that, yeah, this we can add these, we can retire these, we can modify these in this manner, so that then it is able to communicate to the various stakeholders within the sector. So that is really the general idea behind this.
Thank you, Jared. So we still have that concern regarding ICD-11 and the data dictionary, and I've noticed there's the pharmacy as well. Pharmacy aspect probably will also have the procedures, because ICD-11 is really diagnosis and it doesn't capture procedural data. So the health data dictionary is cross-cutting. It would probably, correct me if I'm wrong, Jared, it will capture almost everything in health, not just purely diagnosis, but also the index for pharmacy, procedures, and many others, right?
Exactly. Actually, that is the goal, that we have all the terminologies defined, coded, and we have a central point of reference. I mean, at the end of the day, once we have now a central point of reference, then common reference, then it makes it easier now to start talking about integration. You know, we've been, this idea of interoperability has been there for some time now. And, we cannot achieve interoperability without standardization. And that's why we decided that let's have the NHDD to manage the concepts. That's why we have the client registry, where we are creating unique patient ID, meaning that we have the same patient reference across different service delivery points, across different facilities, while services are being offered to this particular client. Those are, we are talking even about the KMFL, Kenya Health Master Facility List. Is part of the efforts that are being put towards addressing the question of interoperability. So what we are doing is, creating that common language that we can use across. That is really the idea behind this. So all the terminologies within the sector will be now managed within the NHDT.
Sawa. I'm just trying to see if we've answered all the questions. I'm actually in the wrong place. So
and
John is asking.
for the other questions, just to add, we are localizing the concepts, but it doesn't mean that we within the system we are able to map our local concepts with the local codes to other international standards. So we are able to do that one-on-one mapping from one concept to another, so that then we don't lose. If you get, for example, information from outside, you can map it to a local concept, or from a local, you can also still be able to map it to the international standards that are available. So that is why we have the platform, and the platform now allows us to be able to do all those things. The question of mapping from one concept to another. So it's not like once you define it, then you cannot be able now to relate that this concept, how is it related to this international? From the system, we can actually, it allows us actually to have all the international standards mapped to each other within the platform. And that one, again, gives us that flexibility that we are looking at. But as a country, we are saying, if you're in this ecosystem, let's use the locally defined standard. So that then we're able to communicate. But if you want to communicate outside Kenya, then we can be able now to translate to those international standards that you can, we can get the equivalent of those terminologies to the international standards.
Okay. John is asking, the number of health professions is increasing at a high rate. Can the system be used to interrelate the local occupation codes and the international codes used by International Labour Organization? This would make it easier for Kenya and other countries to report internationally.
Yeah, I can.
Yeah. Go ahead, answer. I think you've seen the question.
Yeah, I've seen the question. Yes, the system can be used to provide a solution to problems such as this. So like I mentioned before, we can have our own local sources that has our own occupation codes within the health sector. Then each of those occupation codes, you can create a mapping between them to the equivalent codes within maybe the International Labour Organization's source. Yeah, so we can use the system to address this issue, which is why, as I demonstrated before, one of the objectives of the NHDD was to streamline reporting. So yeah, it can be used to answer this question.
Yeah. Thank you, Ian. So I think we've answered most of the questions. I'm not sure if you've answered Teresa. She said, have you considered adding health promotion and disease prevent indicators? Maybe Teresa can clarify on her question because it seems like most of we are unable to understand. So parting shots, I believe we're done. We've done the presentation, very informative and elaborative one. We've done a demo on how the Kenya National Health Data site is. You can see it's something easily configurable. It's a dictionary that is still in development, and it's a dictionary that is linked to international coding systems like ICD-11. And the beauty about it, it is local, and it will speak to what most of our healthcare workers here are used to saying, and something that is easier for them too. Ian and Jared, if you have any parting shot or any addition to that, let me know. Kindly go ahead. The floor is yours.
Thank you, Dr. for always organizing these meetings. It's a channel through which we can engage and improve on what we are doing, and of course also inform various actors on what is happening at the national level. So as we really appreciate, and we are always there to engage. If there are any questions with regard to what we are doing, maybe I think we should start now sharing maybe even our emails through which then we can start engaging with the various actors. Maybe one thing, there are some questions that are being asked here that I could want to respond to is that we are in the process of coming up with a website that details on how people can actually be able to start consuming from the NHTT. What are the requirements? So we there's the governance aspect that we are working on, and we've given ourselves 2 weeks to see that whatever that is pending to be done within the NHTT is completed, documentation is ready and is available to the public through our website that we are going to publish. So that then from there now we have a structured way of engaging the stakeholders within the sector. Otherwise, mine is free to thank everyone for finding time to participate in this meeting. It has been a wonderful one. I was not able to join. I've been having headache, but I think now it's getting better. But yeah, I know it has been an awesome engagement. Thank you, and over to you, Dr.
Thank you, Jared. With the work you do of coding, I wouldn't be surprised if you have headaches. So, Ian, do you have anything to say before we leave?
Yeah, well, nothing to say. Jared has already said pretty much everything. So I hope we can continue engaging each other so that we can achieve the overall vision of all of this, which is to have a truly interoperable health sector.
Thank you guys for the great work you do, and we are all here to support. So if anybody has a question regarding or rather want to share an input, kindly you can share currently with KNH Research Department, but I believe the team would give us contact so that in the next series we can even add it on the poster. Thank you very much, everybody. Have a lovely weekend. Sunday is National Day of commemorating road traffic accident survivors. As healthcare workers, it would be nice if we share our experiences as well on road traffic accidents and how we deal with basically with how we operate with the survivors. And I hope everybody keeps safe and promotes safe driving. Thank you very much. Have a lovely weekend. Bye.
Bye.